Hi there. This is the first in a series of short videos about how we set up regular monitoring for patients. Now, the first place we're going to start is actually with a recall overview. So the scenario we're thinking about here is perhaps a hospital says, please start this medication and put this monitoring in place. Now, before we look at putting the monitoring in place, we want to check and see what's already there. So in the recall overview, we come to manage recall, and we can see, for example, for this patient, they've got thyroid hormones on repeat. So every 12 months, they're having a TSH. Now, it may be that the monitoring the hospital's put in place or asking you to do is actually going to be covered by our system anyway. So before you go setting anything up that's specific to the patient, we'd recommend add the medication on, save the record, re-retrieve, and then come and look here. And probably a lot of the time, the monitoring will already be in place. We can also see here this patient's got a diagnosis of prostate cancer, and so they're going to have a PSA every 12 months. But say the hospital has written and said, actually, we want you to do 6 monthly PSA. Let's say you've got an enhanced service, so you're getting funded to do it properly. What would you then do? So we're then going to launch a different template called Select Test for Monitoring. It's this hourglass symbol here. If you use it a lot, it might be worth putting on your toolbar. And basically, in this screen, I can pick the timeframes I want to work to. I can see if anything's already been put in place for this patient, and I can make and put in place patient-specific monitoring. And in the next videos, we'll show you how to do that.